the AstraZeneca not so good. Of note, Pfizer did a small study in which they looked at the effect in South Africa, and they found that, as a matter of fact, it was 100% effective. The caveat here is still a very small study. But note the J&J, that even though it was 64% effective in South African study, there were virtually no deaths or hospitalizations. So although the efficacy went down for moderate disease, there was good protection against serious disease. Next slide. Then we have the P1, the one that is right now ravaging Brazil. Next slide. We know from studies now that there's variable protection in real-world effectiveness, namely things that were not done necessarily in a clinical trial. In Brazil, it was 50% effective after a single dose. They went on to a second dose, and that stayed at approximately 50%. This was under the condition where 75% of the cases were P1. Rather similar results from Chile, a little bit better, with 67% effective versus symptomatic disease 14 days after the second dose. Next slide. Now returning to the United States, the California variant 429, 427. Next slide. Here we have mostly in vitro data. And by in vitro data, we mean we take the antibodies that are induced by vaccines, in this case mRNA, and we determine their ability to neutralize the given variant in the test tube. And as you can see, there's a slight to modest loss here of about 2 to 3-fold. This is not likely going to be relevant from a clinical standpoint, since there's a considerable cushion in the antibodies induced by this vaccine. Next slide. And then we have the 526, which was originally the New York and spreading in certain areas in the New York City metropolitan area. Next slide. Here too, we rely on in vitro data with a moderate loss, about 3 to 5 times of neutralizing activity from the mRNA. Again, this is still within the cushion that you would see protected, since the antibodies induced by this vaccine are considerably high. And then finally, next slide, we have the troublesome India 617. Next slide. Now, this is something where we're still gaining data on a daily basis, but the most recent data was looking at convalescent sera of COVID-19 cases and people who received the vaccine used in India, the Covaxin, and it was found to neutralize the 617 variant. So despite the real difficulty that we're seeing in India, vaccination could be a very, very important antidote against this. So I'll stop there with the final statement. The one thing you can gather from everything I've said, that it's very important to get vaccinated. So as Dr. Walensky said, even when you're talking about variants, indoors, outdoors, get vaccinated and you will certainly have a degree of protection. I'll hand it back to you, Andy.
Thank you. Okay, let's go to questions.
Thanks, Andy. And I know a lot of people have questions today, so please keep your question to one question. Let's go to Aaron Billups at Spectrum News.
Hi, thanks for taking my question. Can you guys explain the science behind the guidance change at this moment? Is the understanding that there are enough Americans fully vaccinated to sufficiently slow the spread of coronavirus outdoors, that the likelihood of transmission outdoors is very low? And what about pockets of the country that have not yet reached national levels of vaccination? Should the guidance be different for areas with lower vaccination rates?
Dr. Walensky.
Thank you. There's increasing data that suggests that most of transmission is happening indoors rather than outdoors. Less than 10% of documented transmission in many studies have occurred outdoors. We also know that there's almost a 20-fold increased risk of transmission in the indoor setting and the outdoor setting. That, coupled with the fact that we now have 7% of people over the age of 18 fully vaccinated, and the fact that our case rates are now starting to come down motivated our change in guidance. As noted, this is the third time we've changed our guidance for fully vaccinated people. And as more people get vaccinated and as case rates continue to come down, we will come up with further updates.
Next question.
Caitlin Collins, CNN.
Thank you very much. My question, given this new guidance, should states that have outdoor mask requirements change those to reflect this new guidance? Is that your advice for those states and those governors?
What we're saying is states that have mask requirements outdoors, if people are vaccinated, we no longer feel that the vaccinated people require masks outdoors. So to the extent that those are consistent, I do want to sort of convey this outdoor large public venues such as concerts, stadiums, and things like that. And a lot of that is the inability to distinguish between vaccinated and unvaccinated, and to say that in those settings, when you have that density, we really do worry about protecting the unvaccinated people.
Next question.
Ariel Hart at the Atlanta Journal-Constitution.
Hi, I'd like to go back to the question about for states that do not have yet the national rate, that are below average, should there be different guidance for us? I'm calling from Georgia.
I think the general guidance is to ensure that people start getting vaccinated. And we do know that if you are vaccinated, it is safe to be outdoors without a mask. And the general guidance is the more and more people who get vaccinated, the more you'll have more people who are safer without masks. So get vaccinated. And if you are, then it's safe to be outside without a mask.
Next question.
Kristen Welker, NBC.
Hi, everyone. Thank you so much. Firstly, can you address if the risk of being outdoors is so low, why doesn't this guidance apply to everyone? And secondly, while rates of vaccine hesitancy are dropping, you still have about 4 in 10 Americans who say maybe or no, they're not going to get the vaccine. How do you deal with that hesitancy? Are there any new strategies that you're looking toward?
Dr. Walensky.
You know, we still believe as people are in small gatherings, medium-sized gatherings, when they are unvaccinated, you're at risk. You have people who are at risk of severe disease. So we do believe in those settings, masks should still occur. Certainly, any activity is less risky when you have more ventilation, more space between people, more people wearing masks if they're unvaccinated. But again, I'd go back to the primary principles of being outdoors in general and wearing masks outdoors until you have a vaccine. The second question was confidence?
On vaccine hesitancy, that vaccine hesitancy numbers are dropping, but it's still significant. I just had a conversation with someone yesterday who said they weren't going to get the vaccine. I said, why? This person said, because I need more information. How do you get to those people who are still skeptical?
Yeah, we're spending an extraordinary amount of effort through our community cores in doing this outreach. We knew that we were going to first vaccinate everybody who was rolling up their sleeves immediately and wanting it. And then we were going to have to do the work of meeting people where they are, understanding their reasons for not wanting to get vaccinated, and really explaining, is it about the science? Is it that you felt that the science was too fast? We believe and know that the science moved quickly. We've enrolled in 100,000 people in these trials. And the science stood on the shoulders of years and years of work before to be able to deliver these vaccines. Dr. Fauci has previously talked about that. If people are worried about the side effects, we can convey the data of over 200 million vaccine doses delivered and the safety and the scrutiny of that safety. So we really need to meet people where they are and understand why they might be hesitant, and then give them the information that combats that hesitancy.
Yep. Dr. Fauci, anything you want to add about the development of these vaccines over the last couple decades?
Well, yeah, I mean, as Dr. Walensky said, we try to go step by step of what is it about the situation that makes you hesitant. And one of them is, in fact, the speed with which this has happened, because we've been talking for a long time that vaccines usually take years to go from a recognition of the pathogen to getting vaccine into people's arms. We did it in 11 months. But as we've said often, that is a reflection of decades of scientific advances in two major areas. One, vaccine platform technology, which led for the years of work to perfect the mRNA and the vector, such as the adenovector approach. And secondly, structure-based vaccine design that led to the precise, correct conformation of the spike protein, which proved to be so immunogenic and in fact got translated into a highly efficacious vaccine. You're talking about decades of fundamental science. When people hear that, they realize that this was not being rushed, that they are benefiting from the culmination of years of research.
Kristen, I think one thing that we're cognizant of and always have been is everyone has their own decision-making process. Some people decide quickly, some people take a little bit more time to decide. I think it's important that we respect everybody's decision-making process. And the person that you spoke about, our advice to them is talk to your doctor, talk to your pharmacist, talk to people you trust, talk to people who've taken the vaccine. And I think the picture that emerges is 130 million Americans, hundreds of millions more overseas, significant differences in their safety, and the risk of these viruses, particularly the variants, is just too high. So as more people do their own homework, we'll give them the time and the information and the local resources through the community core to do that homework. And we think that that is what is responsible for moving more people in that direction. Next question.
Cheryl Stolberg, New York Times.
Thank you for doing this call. This is for Dr. Walensky. Dr. Walensky, you talk about small and medium-sized gatherings, but you don't define what they are. So I'm wondering, can you please define for people what a small and medium-sized gathering is, or say why you aren't defining it, if there's some reason for that? And then separately, you talked a few weeks ago about feeling a sense of impending doom. And I wonder if you could reflect on that and talk a little bit more about how you feel right now, given the numbers.
Thank you for that question, Cheryl. You know, what I'll get back to is the basic concepts, because if we define a small and medium-sized gathering, we actually also have to define the size of the space that it's in, the ventilation that is occurring, the space between people. And so I think we should get back to the general concepts. Small and medium-sized gatherings for people who are outside and vaccinated can safely be done without a mask. But we really do want people who are unvaccinated to limit the interaction with people and to go back to the basic principles of increased ventilation and increased spacing for any given size. You know, several weeks ago when I had this feeling of impending doom and I articulated that, and I had, you know, case rates going up, vaccinations growing, but not where we needed to be, and deaths continuing to climb. As I look at the curve now, it's stabilizing, it's coming down. The vaccinations have continued to grow in an extraordinary way. I think we really do need to get more and more people vaccinated. As Kristen noted, we need to sort of combat the hesitancy that is out there, meet people where they are, and encourage everyone to get vaccinated. But as I see more vaccines getting into people's arms, more and more people being willing to do so, confidence increasing, and then I match that with the cases that are starting to stabilize, plateau, and come down, as well as Dr. Fauci's slides that demonstrate when the other countries have been a little bit ahead of us and shown that when those vaccinations continue to soar and the cases plummet, that we should be in good shape.
Next question.
Zeke, AP.
Thanks for doing this. Dr. Walensky, I was hoping you can clarify a little bit, why are the people who are fully vaccinated wearing masks in all of those different scenarios? Is it to protect others from them in case they have a breakthrough infection? Is it protect themselves from potentially acquiring a breakthrough infection, or is it to model safe behavior for those who are not vaccinated around them in all of those spaces? And then also, do you have any targets by which you would sort of begin to roll back, how many people need to be vaccinated in society for you to begin allowing people to wear masks at baseball, to take their masks off at baseball stadiums or in indoor dining or the like?
Yeah, thank you. Maybe I'll tackle that second question first. And that is, I think some of these targets have to be the interplay of the number of people vaccinated and the number of cases that we're seeing. And it's that intersection that I think is going to be important. I think that part of one of the things that we need to look at is the lack of uniformity of vaccination rates across this country. It was previously brought up, not every state, not every county is vaccinating at the same rate. And where we have low areas of vaccination, we are going to potentially see more outbreaks, which is why I think we have to be careful and we have to make sure that people get vaccinated in all corners and in all counties. With regard to why people who are vaccinated are wearing masks indoors, I think what we really need to convey here is we still have 50,000 cases a day. We do believe that vaccinated people are much safer when they're wearing those masks indoors, as indicated by the green on the right side of that graphic. And right now, it's very hard to tease apart who is vaccinated, where they are in the vaccination. So it's not just to protect themselves, but largely to protect others and really to protect the unvaccinated.
All right, next question.
Let's go to Stephanie Abbs at ABC.
Thank you. I wanted to ask about a different topic, actually. The reports that the Pentagon is tracking 14 cases of heart inflammation or myocarditis among service members and families, people who were vaccinated through the military healthcare system. Can you tell us any more about those cases and what CDC knows, or maybe what Dr. Fauci can tell us about any potential relationship to vaccination?
So maybe first we'll go to Dr. Walensky, if you have any familiarity. Nope.
Yeah, I'm aware of those reports. I don't necessarily want to comment on what the DOD is doing and investigating in their own investigations. What I will say is we've delivered over 200 million doses of vaccine, of these vaccines. And after hearing about these reports, we again looked back in our vaccine safety data and we had not seen any reports of those. Those have since been reported to us, and so those investigations are ongoing. But it is a different demographic than we normally see, and we will be working with DOD to understand what is happening in those 14 cases. We have not seen the signal, and we've actually looked intentionally for the signal in the over 200 million doses we've given.
So not enough data yet, early. Okay, next question.
All right, we got time for one more question. Let's go to Anjali Kimlani at Yahoo.
Thank you so much. Really quickly, can you walk us through the timeline of the aid being sent to India, specifically first on the ventilators and protective gear and oxygen, and then secondly on the vaccine doses, when you anticipate those will be sent out?
Yeah, I mean, we're beginning to move immediately. I can't give you the exact timing on each of those pieces, but we're in constant contact with the Indian government and the Indian health authorities. As I think I mentioned earlier, we have a CDC team that's headed over to India to help coordinate this response. In terms of vaccines, as I mentioned earlier, we are in a position now where we can foresee that we will not be using the AstraZeneca doses that we expect to come online. I want to be clear that none of those doses are yet made available based upon FDA inspection. So once that's done, as soon as that happens, we will have 10 million doses available. Those will be distributed globally. And then we expect over the next couple of months, another 50 million. This is, of course, in addition to many of the strategies that Dr. Fauci, myself, Jeff, and others have talked about for supplying the globe with additional vaccines and additional vaccination efforts through COVAX. And finally, I think you may be aware that we are making sure that we are locating some of the raw materials necessary to create more vaccines in India, which I think is going to be an important help there. So with that, I'm going to bring this to a close. Thank you for all your questions, and we'll be here doing this briefing again on Friday.